Here's a case of hyperhidrosis. How old are you? How old are you? 28. 28-year-old female, a case of hyperhidrosis, primary. So we did an ultrasound to identify the location. We did a moisture checker. Moisture checker shows that the moisture level at the normal skin, the forearm, is about 38, while in the palm is about 48. So it's quite moist on the palmar area. Now we did an ultrasound to identify the nerves. So we're going to give a radial, median, ulnar nerve block. Okay. Now after the block, of course, the area will be numb, so we can do a procedure. At the same time, you may have some amount of weakness temporarily for an hour or two. All right. But besides that, there won't be any other problems. But that weakness is not because of the toxin. That weakness is because of the lidocaine. Okay. Are you? But you'll be wearing off in about half an hour's time. Don't worry. So, based on my ultrasound, I can identify that the ulnar, radial, and median is about 1 cm depth. Okay, just relax. One small jab. Okay. Okay, 2 more, all right? I'm not going too deep, but it's sufficient to give you enough pain relief on the palm, all right? You okay? It's okay. Last one. After you've been numb, don't worry. All right. So we've done the radial, we've done the median, and now the ulnar. Okay. Got some fine vessels here. Okay, good. Be careful when you give these blocks because the wrist is highly vascular and we don't want to have any bruises coming on there. All right. Wait for a couple of minutes and let us know when you start to feel numb on your palm. Okay. Now in the meantime, we will draw the grids that we are going to inject. Okay. Okay. Now, we'll mark up this. So for the palm, okay, textbook will give a different description, but I prefer to play it safe than sorry. So we'll do a 9-grid injection point. So I got 1, 2, 3, 4, 5, 6, 7, 8, 9 grids. Okay, you all right? All right. Now, do you sweat a lot at the tip of your fingers? You do. Okay. All right. So we'll do 1, 2, 3, 4. 1, 2, 3, 4. I'm not going to do the proximal. I'm only going to do the distal and the middle because you need the proximal to flex. All right. And same here also. For the thumb, I'll just do the distal. All right. So I'm going to do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18 injection points. All right. Okay. So we're going to do, since you have not done toxins so far ever, all right. So we'll do 0.05. Okay. I'm afraid 0.1 is what's recommended, but your hand is small. Okay. And at 0.1, I'm afraid that you may have weakness of the palm. Right. I want you to squeeze my fingers tightly. Squeeze. Tightly. Okay, relax. Also, before you do these procedures, assess the muscle power. All right, you need to know what is the muscle power before the procedure. Okay, and assess a week after that. If you don't assess now, you'll never get a chance to assess later. That's very important. Right? Do you feel numb on your palm? Numb already? Good. All right. So now I'm going to wipe the palm again. So I'll take about 0.9. Thanks. Yes, please. Now, if you notice, we are using a Lure lock glass syringe with a 33 gauge 4 millimeter needle. So we're going to give 0.05. So what we are going to do is just going to step and push. Okay, at 4 millimeters, you don't want to step too deep. Just step lightly, because we don't want to bypass the hypodermis and go into the muscle. All right. Again, like I said, be very, very careful when you do these blocks. Okay, if you injure the nerve, you got another new set of problems. Sometimes if you're not sure about it, you rather give some chiro anesthesia and manage with that. Okay. So to recap, 28-year-old female, Palmar Hyperhidrosis, moisture level 38, moisture level 48. We have done a radial, median and ulnar nerve block, 9 grades. Okay, I'm going to start in the middle first, okay? Now one small tiny jab. You feel a little bit of discomfort. You okay? Was it very painful? Okay, good. If the block was not given, it would be quite painful. At the same time, I gave a reasonable amount of block so that pain is suppressed but not completely eliminated. You okay? You notice I'm going at a 45-degree angle. I'm not going at 90 degrees because I still want to make sure that I'm in the dermal layer. Okay. So I've got to do 3 more here. Okay. So you notice I'm still trying to minimize my entry. I'm not trying to go very deep. So I'm going at 45 degrees. Okay. I'm actually, even though I wanted to give 0.05, I'm doing slightly more than 0.05 actually. Okay, now for the thumb. The palm is done. Yeah. So that I really want to avoid the chance of me going deep into the muscle. Okay. Now I decided not to go for the proximal phalanx. All right. Just cut this. All right. Now I'm still very skeptical. See, the reason why I don't mind doing it again is, all right, I can always touch up on the proximal phalanx later on, but if I knock out the functionality of the hand, I can't forgive myself for that. So that's the reason why I'm being very, very careful. Was it very painful? Pain score? A little, okay. 1 out of 10, 10 cannot tahan? Okay, fine. All right. Even for the median nerve block, right, ulnar nerve block, we try not to completely numb the hand. Make it comfortable, right? If I give about less than 0.1 ml on each tree of that. If I completely numb it, then the weakness will also set in together with it. So that's why I didn't want to do that. Okay. Okay. So we have blocked one side only, the left hand, because she's right hand dominant. So in about a week from now, we need to check her moisture level again. Right? So we will take note of it that currently the moisture level is 47.8 compared to 38.4 here. Okay, and so in about 2 weeks from now, when you're coming for your class, ask her to come along. We'll check the moisture, look for functionality. Then we'll do the same on the other hand. Do the 3 blocks: median, ulnar, radial block. All right, and then do the same thing. So we'll repeat the same procedure. 9 spots in the center. Thumb proximal, sorry, distal, I beg your pardon. Okay, and all the other phalanxes distal only. Okay, let's spare the proximal because we need flexion, right? So if it works well enough, it should give sufficient control of the hyperhidrosis. Remember, anhydrosis is not the objective, it's to reduce the sweating. I think if you can reduce the sweating by about say 70%, it's quite good enough.